So one of the big problems that we've had in screening for decades is that we've been screening the wrong men. So there's been studies that have shown that if you're a 78-year-old man with 3 comorbidities, you have heart disease, you have lung disease, you have diabetes, you're more likely to get a PSA test than if you're a healthy 54-year-old. Now, the probable reason for that is that people aren't thinking about giving PSA tests consciously. They're just, patient comes in and they need their cholesterol taken, and like, oh, let's do a PSA test too. But obviously that's completely the wrong way of doing it. If you're going to give somebody a test for cancer, that's a big decision. It has to be taken consciously. And we should not be giving the PSA test to men who have absolutely no benefit. An older man who is sick is more likely to die of some other cause long before he would ever discover that he had the cancer that would be screened detected. So we've been screening, that's the number one thing. We've often talked about the problem of PSA screening has been huge numbers of men overdiagnosed and overtreated. Some estimates that are since the introduction of PSA, 1 million Americans have been overtreated and overdiagnosed, which is obviously a public health disaster. But what's interesting is if you split out the data, almost all of that has been happening in older men. We wrote a paper showing that if in 1987 the rule had been you can't get a PSA test if you are 70 or older, that would have reduced the amount of overdiagnosis by nearly half, 42%, just that one thing. So we're talking about this in PSA screening, this balance of harms and benefits. And here's a very simple way that everyone agrees with we shouldn't be screening older men. If we could actually implement that, we would instantly decrease the harms by almost a half.